What follow-up care do I need after a bladder biopsy? After having a bladder biopsy, it's normal to wonder what comes next. The main goal of follow-up care is to ensure your recovery goes smoothly, watch for any symptoms, and understand what your biopsy results mean for your health. Right after the procedure, you might notice some blood in your urine, which is common. You could also feel a mild burning sensation or discomfort when you urinate. Some people experience increased urinary urgency or frequency. These symptoms usually improve within 1 to 2 days but can last up to a week. To help your bladder heal, it's best to rest and avoid strenuous activities or heavy lifting until the bleeding stops. Drinking plenty of fluids is also helpful because it flushes the bladder and reduces irritation. If you received anesthesia, avoid driving or operating machinery until you are fully alert and recovered from the effects. Your healthcare provider will check for signs of excessive bleeding, infection, or trouble urinating before you leave the clinic. They might prescribe antibiotics to prevent urinary tract infections, especially if the biopsy involved inserting instruments like a cystoscope. Once you're home, it's important to monitor your symptoms closely. If you notice heavy bleeding, severe pain, fever, or difficulty urinating, contact your doctor promptly. These could be signs of complications needing medical attention. A key part of follow-up is reviewing your biopsy results. It can take up to 2 weeks for the tissue to be examined under a microscope. The results will show whether abnormal or cancerous cells are present. Based on what the pathologist finds, your doctor will recommend next steps. If cancer is detected, follow-up care becomes more detailed. For example, if bladder cancer is diagnosed, your doctor will likely suggest regular cystoscopy exams to check for recurrence or progression. The frequency of these exams depends on your risk level. Low-risk cases might need cystoscopy at 3 months and again at 1 year, then possibly no further routine checks if no issues arise. Moderate-risk patients often have cystoscopy at 3, 9, and 18 months, then yearly up to 5 years. High-risk patients may need cystoscopy every 3 months for the first 2 years, then every 6 months for the next 2, and annually after that. In addition to cystoscopy, urine tests such as urine cytology can help detect cancer cells shed into the urine. Imaging scans like computed tomography, magnetic resonance imaging, or positron emission tomography may be recommended if there's concern about the cancer spreading beyond the bladder. It's very important to keep all scheduled appointments and to communicate openly with your healthcare team. If you develop new or worsening symptoms like heavy bleeding, severe pain, fever, or trouble urinating, seek medical care right away. Remember, follow-up care is tailored to your specific biopsy results, overall bladder health, and risk factors for cancer. Always discuss your individual situation with your healthcare provider to get the best personalized plan. In summary, after a bladder biopsy, expect some initial symptom monitoring and supportive care, followed by careful review of your results and a personalized schedule of follow-up tests. This might include periodic cystoscopy, urine tests, and imaging to catch any issues early and keep your bladder healthy.